Greetings, everyone. The article that I've done for this discussion was decision making and how it's affected in obstructive sleep apnea syndrome. It was done through the Journal of Neuropsychology, and the research done in this article was in regards to how one's decision making ability is affected due to an occurrence known as obstructive sleep apnea syndrome. And when this happens, it creates an obstruction of the upper airway, which in turn then causes sleep division and does not allow for a good night's sleep. There are many decisions that need to be made on a daily basis, and if someone has not had a good night's sleep, then their abilities to make those decisions can be at a deficiency. The method they used was to have 20 patients with obstructive sleep apnea, or OSA, come into their sleep lab and undergo different assessments. Their sleep was recorded using standard sleep recordings, as well as measured items such as the nasal pressure and the respiratory effect. Oxygen saturation was continually measured, and all of these assessments were matched against 20 healthy individuals, matching those that were actually in the research test. Sleep disturbance was assessed, and as well as any daytime sleepiness that had occurred. The independent variables are the OSA, which all the participants have. None are taking medications. The testing was done in a lab and not in each individual home. So this was actually a very controlled research that they did. The decision assessment included decks of cards, and the student or the subject choosing the cards from 4 different decks. 2 of the decks would work to their advantage, and 2 of the decks would not. They did not know ahead of time which was which. However, they did have to calculate on the fly, so to speak, and find the advantage that would give them the net gain at the end of the cards. And the results were either a net gain or a net loss. These results showed a better decision-making ability with the control individuals versus the testing ones. Those in the study did not migrate to the advantage decks like the control ones did. Therefore, proving the ability to make decisions is hampered due to the inability to sleep well. The healthier individuals resorted to making better decisions and making them quickly, whereas the testing subjects were unable to do so. This does not prove, however, any or all decisions are affected on a daily basis, but that the possibility is there. Strengths of the study include research methodology that was used and the design of the whole study. It was an effective cognitive test in order to prove or disprove their hypothesis. There were a couple of weaknesses as well. The first was the amount of people that were used. There were only 20 people used in this assessment, and having general statements for the worldwide group of those who suffer from OSA it seemed to be a little bit unfair to the entire group when only using 20 people. The second weakness I see is the assessment as a whole. If an individual does not receive a full or a good night's sleep, it would only seem natural that the decision-making abilities would be affected. I understand that there were variables here, but this really does seem like an easy answer even without the research or the testing. Ways to improve would be to have real-life situations available instead of cards, perhaps situations like driving, a driving simulator, or an office setting where executive decisions need to be made that affect other people instead of having a lower score on some cards. Using more people would also be an improvement. Perhaps 100 people in real life situations would give a better insight on everything there. And that was the overview of the article.